thank you so much. And before we start the presentation, I want to share with you a small video we did with the Nightingale Initiative to celebrate our achievements as nurses and midwives, because we do contribute, and most of the time nobody knows what we are doing. So we thought we might want to highlight some of the key areas where we've made a difference. Thank you. Well, thank you so much. That just introduces and explains actually what we are all about and what WHO does in support of nursing and midwifery globally. So my presentation will really take it from where we've started now to just elaborate on how exactly do we go about advocating for universal access. I'm going to cover a few areas. I'll talk about the core WHO functions, the universal health coverage, SDGs, and other strategies, and how we advocate. I'll also present some key World Health Assembly resolutions. And then I'll also present some operational frameworks within our department, which include the Global Strategy on Human Resources for Health, and strategic direction for strengthening nursing and midwifery, and also come back to show how we really advocate, and also the new conceptual framework which we've introduced in a publication on universal access for nursing and midwifery contribution to universal access. I hope I can demonstrate that we really we should all be part of advocating for universal access because we are the pillars of the health systems. There are several core functions of WHO. The first one is providing leadership on matters critical to health and engaging in partnerships where joint action is needed. WHO is basically a leading agency in health, but we don't do it alone. We have to work with various key strategic partners. We are also engaged in shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge. And we have heard from Dr. Patty Jody here about knowledge management. You know, that is very important because we do the research, but it has to be disseminated and shared so that it can be used. The other part is setting norms and standards and promoting and monitoring their implementation. This is part of our work as technical officers in the World Health Organization. We engage partners, collaborating centers, because Secretariat is so small, but we rely on experts to work together, develop norms and standards that are almost applicable to everybody, globally, but of course they have to be adapted in different settings. There is also the area of articulating ethical and evidence-based policy options. We have to take into account the principles of ethical considerations when we develop evidence and when we do our work, looking at different cultural contexts, for example. Then the provision of technical support, which actually is catalyzing the change, because when we provide the technical support, then we expect the capacity building that results from that can be a catalyst to making change, which is sustainable in the respective countries. And of course, issue of monitoring and evaluation of trends. This is at a global level. So we translate this now at our own level. Now, the other thing that we do is looking at what are the global trends, what are the global mandates, what is happening in the world, how can we use that information to actually improve the health systems. And so currently we know there is the issue of universal health coverage. There is also, which in 2005 was agreed upon, and we had commitment, WHO and these member states committed to implementing universal health coverage. And since last year, December, there was the agreement on Sustainable Development Goals. And all of you know that before we had the MDGs, Millennium Development Goals, they have not gone away. The things that were in there have not gone away, but there is a new impetus to looking at them differently and looking at ways of working with them in a different way. So here, there are two documents here. There's a document on the right. I don't know, your right? Yeah, my right. On Sustainable Development Goals, which you can find on the web. And also there's a lot of information on universal health coverage that WHO has produced. Next one. Okay, just to emphasize why it's important to use these as the key reference points for advocacy for universal access. If you look at the Sustainable Development, It is a new, though it's a new paradigm, which is interlinked, integrated, and universal across economic different economic settings and social dimensions. It's also focused on the poorest and most vulnerable. But at the same time, no one should be left behind, because even in developed countries, there are issues. So it's a movement that takes into account of all aspects of populations. It's been accepted and is applicable to all countries regardless of their economic status. And for us at WHO, there are several goals there, but goal 3 is the most important one for us because it's specifically on health. And goal 3 is specifically important to my department, which focuses on human resources for health. Goal 3 says, substantially increase health financing and recruitment, development, training, and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. So this is relevant, so relevant to our department. And then when you look at universal health coverage, the goal is to ensure that all people obtain the health services they need without suffering financial hardships when paying for them. And this requires a strong, efficient, well-run health system, a system for financing health services, access to essential medicines and technologies, a sufficient capacity of well-trained, motivated health workers. So basically, universal health coverage means providing a full spectrum of essential quality health services, which include health promotion, prevention and treatment of disease, rehabilitation, and palliative care. So you can see that, it really mirrors what is in the Sustainable Development Goals. Having this as reference points, we also have another reference point for WHO, which are World Health Assembly resolutions. The first one here, which I'm showing, is on the one on universal health coverage. That's WHO 5833, which talked about sustainable health financing, universal coverage, and social insurance. Then we have another strategy apart from the resolutions, because there are many. I'm not going to mention them, but here I just picked one which is relevant to the topic, which is universal health coverage. The second part I want to talk about is that based on these resolutions, then we also have to develop operational plans. How are we going to introduce this into countries? So we have in my department currently, we've been developing a global strategy on human resources for health. We are calling it Health Workforce 2030. And in line with that, we are also developing the new strategic directions for strengthening nursing and midwifery. And actually, there's been, as you know, people have been questioning, do we need another strategic direction? Because this is not the first one. There was one in 2002 to 2008. Then we had an update 2011 to 2015. And then many people were saying, do we need it anyway? So we said, okay, since we always talk about evidence-based information, let's do a survey. So we did a survey, and 98% of those surveyed, 96 I should be precise, said they needed a standalone document. So this is why we are now, developing this new strategy. And through this strategy, we expect to provide leadership in universal health coverage, shape the research agenda. So this dictates what the content of the strategic direction is going to be, articulates various policies, build capacity, convene and strengthen partnerships. We can't work alone. We know we work with collaborating centers. We work with the International Confederation of Midwives. We work with the International Council of Nurses. So really, we are putting into practice the core functions of WHO as part of advocacy. Yeah, these are the various resolutions which I won't go through, but we have plenty for nursing. We have had since 1948, 10 so far. They are not all here, but here I try to put the other relevant resolutions on human resources for health. The global strategy on human resources for health, which I've just mentioned, it has four main objectives. optimize performance, quality, and impact of the health workforce in pursuit of universal health coverage and sustainable development goals. Anticipate future workforce requirements by 2030, harnessing the growth in health labor markets to maximize job creation and economic growth. Build individual and institutional capacity to manage HRH policy, planning and implementation, strengthen the data knowledge. And as you see, it's more, we are deliberately trying to put out a positive message. We are moving forward. Let's not complain. We know our problems. Let's not continue complaining, but what are we going to do about it? So, because we work within this, our work in nursing and midwifery is within the Department of Health Workforce, the strategic directions have to be in line to the broader operational framework. So we have now drafted this strategic direction for nursing and midwifery, which you will see is slightly different from the previous ones. The language is also positive because we are now looking at the future. Our vision, as you can see in this conceptual framework, the vision is up there. We are saying we will need to see that there is available, accessible, acceptable, quality and cost-effective nursing and midwifery care for all, based on population needs and in support of universal health coverage and sustainable development goals. So we are in line with the global strategy. We are in line with the global mandates. So these are our advocacy messages. Then we have 4 thematic areas. The first theme on the left here is ensuring an educated, competent, and motivated nursing and midwifery workforce within effective and responsive health systems at all levels and different settings. So this is one area where there is a lot of interventions that we have identified at a global, regional, and country level. The next one is optimizing policy development, effective leadership management, and governance. We found that governance is a very big issue. And so we don't want to say there has not been any governance at all. There has been some governance, but how do we optimize that? So that is in the future. And then working together to maximize the capacities and potentials of nurses and midwives through intra- and interprofessional collaborative partnerships, education, and continuing professional development. We know that we have to work in teams. If we want to deliver on universal health coverage, we have to work with other team members. But how can nurses and midwives do that effectively? Taking a lead and working collaboratively with the other team members. And the other thing here is continuous professional development. It's not enough to be qualified and competent at a certain point in time, but how do we move forward when things are changing? There is SARS today, tomorrow is Ebola, the other days to be Zika. We need to be continuously being updated. The other part is mobilizing political will to invest in building effective evidence-based nursing and midwifery workforce development. Most of the time, we want to work on our own. And we try to work with others, but let's make an effort, a bigger effort, to work with the politicians to ensure that they support us. If I give an example of government chief nursing officers, they are working in the ministries of health. They have the potential to work with the permanent secretary, the director of medical services, the minister of health, to sell their case so that investment can be made available for them to do the work that they are expected to achieve. And as I said, on the right side there, we have interventions which we've outlined at country level, regions, at global and partners level. And then at the bottom, we have at least 5 key principles. We want to ensure ethical action. Again, this is in line with WHO core functions. We want to make sure that the interventions or the approaches that we adopt are relevant to that specific context, that people feel they own the interventions, that partners are engaged. We are not alone in this business, that are engaged and we are collaborating. And whatever we do is of good quality. Education of good quality, services of good quality. So we need also to be considering other mechanisms that ensure these things are in place, for example, regulation and so forth. So this is just a summary of the content of this document. And I just want to acknowledge people who are part in developing, this document, the drafting of this document. There's Dr. from Thailand there and Dr. Palazzi from Botswana. So they were there in the drafting of the initial draft. Yeah. So how do we advocate? In advocating, we are emphasizing investment in workforce management, pre- and in-service education, regulation, and positive practice environments, the preparation of our nursing and midwifery leaders to meet the challenges of the dynamic requirements of universal access, the need to delineate, monitor, and evaluate roles, functions, and responsibilities of the nursing and midwifery workforce. Sometimes there's this fuzziness, between roles and function. You see, today there's community health workers, they are doing this, and nurses are doing this and this. So we don't know who is doing what. And also the issue of counting. Who is a nurse, who is not a nurse, it's very difficult. So these are some of the things that we should be clarifying ourselves as nurses, because we know ourselves, we know our contribution. So this is part of the work that we envisage in the future. And of course, building political support at the highest level of the health systems and within civil society for universal access and SDGs, ensuring people-centered services. Now, as I said in the beginning, that there's a paper that we have written, which was actually written as a response to the very same topic, universal health coverage, universal access. It was the time we did the video, and we said, okay, why don't we have a background paper on this to support that work? And you can find this publication in the HRH journal. It actually emphasizes the role of the nursing leadership in universal health coverage. So it means people in collaborating centers, people in the governments, in the educational institution, in the wards, all those people who are actually leading the delivery of nursing and midwifery services. There are various areas to focus on. There's policy and regulation improvements, HRH management, which includes personnel, administration, supply and retention, roles and functions, which I've already mentioned, performance management, information systems. This is actually delineating some of those things I mentioned in a global way. Then in the middle there, you see there's nursing and midwifery leadership and governance, which should be the top first thing. Then you go down, there's nursing and midwifery workforce strengthening. If you have the governance structure, then you can do the strengthening of the health workforce. Then you go into practice setting, you do the same. Then in the long run, what we are trying to ensure is accessibility, availability, acceptability, and quality services. Again, this feeds back into our vision. On the far right there, we have the leadership process and practice, which I've talked about, team building, motivation, and all those things. And as you can see, we are continuously interlinked in working with the partners. I just want to say, because this should be a motivational speech, which I became a bit more technical, but we are here as nurses. We know that there are existing global trends and mandates. We have an opportunity to advocate wherever we have access to internet. We know what is going on. We have the opportunity to advocate, and the requirements to deliver on universal health coverage are basically nursing and midwifery. If you look at where the delivery of interventions can make a difference, it will be nurses and midwives. We know that we can lead in interprofessional collaboration. We lead teams. That's part of our education. Managing wards. Let's take this opportunity and lead those teams. And then we know, this I've already talked about, we are at the core of the delivery of interventions for universal health access. So we need concerted efforts. We shouldn't say, I'm a midwife, I'm going to be a midwife. I'm a nurse, I'm going to be doing nursing. Let's see how we can work together for the benefit of this one individual, the patient, the family, or whoever comes to seek health for better health outcomes. And thank you so much.